Welcome to this LBCA conversation with Claire Turner of Lobular Breast Cancer UK. Lobular Breast Cancer UK was launched in 2019 with guidance and inspiration from LBCA founder Lee Pate. And Claire, correct me, it looks like I've got a date wrong, maybe?
21.
2021, sorry. And LBCA and Lobular Breast Cancer UK have been collaborating on a number of initiatives, including the ILC symposiums ever since. The website is lobularbreastcancer.org.uk. And as noted on the website, LBC UK works to save more lives by unlocking the challenge that is lobular breast cancer. The vision is that lobular breast cancer is understood comprehensively, diagnosed effectively, treated uniformly, and patients have access to support across the UK. Welcome, Claire. I am so happy to be able to showcase you and the work you've been doing in support of your vision, which is also our vision, and also to be able to share with you, share with all of our viewers, another example of effective lobular breast cancer patient advocacy, and to elucidate some of the different challenges that lobular breast cancer patients in the UK face. Of course, I'm also going to look forward to hearing about your plans for advocacy on Global Lobular Breast Cancer Awareness Day on October 15th. We'll come back to that. But let me start by asking you, what is the landscape of lobular knowledge and research in the UK?
I mean, it feels like there's a real energy in the UK at the moment, Laurie. I mean, I've been involved in advocacy since 2019, and that's before, obviously, we started Lobular Breast Cancer UK. And I remember when I was kind of looking for people who were driving, seeing if anybody was doing anything with lobular in the UK back then, kind of 6 years ago now. And I kind of found a handful of researchers and clinicians. There was University of Edinburgh, there was Institute of Cancer Research, Royal Marsden and King's College. There was that real sense that there wasn't a lot happening. There were links with the European Lobular Breast Cancer Consortium that started as well in Europe. But I think what's happened and what we've seen over the last 6 years is a real growth in understanding and also research. An example is one of the things that we run at Lobular Breast Cancer UK. We've now set up the UK Lobular Breast Cancer Network, where we just invite any clinician and researcher that's interested in lobular to come along once every 6 months, talk about what their research is, what resources they've got, and to kind of collaborate. And the last time I looked, and we got 2 new institutions that had joined, we've got about 30 individuals now from across the UK, different academic institutions, hospitals, research centres that are all kind of working together from basic biology right through to the potential, kind of looking at clinical trials and beyond, collaborating. And one of the great things that came out of it, for example, was we discovered that the University of Glasgow, for example, has got a 250 lobular tissue bank with comparable clinical data that nobody else knew about. And the amazing pathologist, Joanne Edwards, who's based there, is now saying to all the rest of the clinicians and researchers, let's work together. If you need lobular tissue, we've got that. So we're seeing real change and kind of greater collaboration and a greater interest in research in lobular here in the UK, which is brilliant.
So can we back up and you can tell me more about the formation of Lobular Breast Cancer UK and what the role is explicitly? Yeah.
So basically, I think like so many of us, I had a very difficult lobular diagnosis. It took me 5 years I was kind of 41 when I first went to my GP saying there's something weird going on in my breast. Didn't have a lump, thing was so here so regularly. So it took 5 years, multiple imaging and multiple mammograms, ultrasounds, biopsies. And then I ended up with what I thought was a 1 centimetre tumour, was 8 centimetres plus. And then I was told I was going to be monitored with mammogram, even though it'd take me 5 years to get diagnosed. And I was in that like really dystopian moment. I think so many of us have known, where you go, did you say mammogram? You're carrying on monitoring me. And I thought something needs to be done. And like you said, I reached out to, and I'd heard about this organization, Lobular Breast Cancer Alliance in America. And I thought, oh, right, I'm going to reach out. And I had a meeting with Lee Pate and Laurie Petiti and just said, how can I do something similar? I think we need something similar in the UK, or can I work with you? And I think just because the health systems are so different, that I thought, and when I spoke to the clinicians and researchers that I first contacted, we thought that actually we need something here in the UK. And having worked in the charity sector for 30 years, I'd actually stepped back from running charities because I decided after my diagnosis I didn't want to run a charity anymore. I was going to be a bit more relaxed. That actually I needed to set one up, not as a job, but as an addition to my work as a voluntary role. So I'm an absolute believer in collaboration, and it's not just my voice that matters. So I put a call out on social media. Who else has had a lobular diagnosis? Would anybody interested in setting up a charity? And we had our first meeting December, I think it was 2019, just before the pandemic, down in London. And there was 10 of us sat in a room in London, talking about what we went to talk about setting up the charity, but because none of us had ever met anybody else who got lobular, we ended up talking about having lobular. But then that was kind of the birth of the start of LBC UK and what we wanted to do. So we've got three really clear kind of strategic aims, and one's increasing the thing that so many patients say, what's lobular? No one's told me anything about it. So really building lobular patient information and knowledge and support. We co-create with patients, patient resources. We also work with a lot of larger organisations that reach more patients, like Breast Cancer Now. We've worked with them on developing and refreshing their lobular leaflet. We've trained their helpline nurses so that if people ring up with lobular, their helpline nurses understand what the patient experience might be and the different worries that a patient might have. But we also do quite a lot of that, of clinical information and training. So we've recently spoke at Bart's Hospital. They have an annual breast health day. So we met with their whole of their breast care team to again, talk about lobular and how it can impact us as patients differently, the different biology of lobular and what they can do as health professionals to support us and our concerns. We also work with researchers and research clinicians. We do a lot of that. We've kind of, an evidence base is massively important to us in all the work we do. So we work with clinicians and researchers on identifying what's the research we need, developing research proposals, and then supporting them and helping them to get funding. But we've also done our own research. We spotted a real gap in the psychological and psychosocial impacts. And as two of our researchers, one's a health psychologist and one's a psycho-oncologist, we've been doing some research in how a lobular diagnosis can psychologically affect patients differently. So we've been working with University of Aberdeen and De Montfort University on those. And then from that, combining all that information that we've got and all the research and evidence we're gathering, our third thing is that real change of policy and guidelines and really affecting really getting lobular recognised as a distinct disease in policy and the treatment guidelines that we have. And also about making sure that we have access to the most appropriate effective treatments and drugs for lobular as well. So that's kind of our little triangle of what we work to do at LBC UK.
Is it your sense, or are there challenges that might be different facing lobular patients in the UK than in the US?
Yeah, I mean, I think the first really obvious one is that we've got the NHS here. And it was really interesting when I was recently at Project Lead Institute doing the training that you supported me so brilliantly on at LBCA. And we were comparing, I was having a chat one day with other advocates about the pluses and the minuses of the system you've got in the US and then the system we've got here in the NHS. And I think one of the key things with the NHS is, and this is there's a real postcode lottery across, even though it's the NHS, it's very different from if you're for example, you're in a city and you might be at a teaching hospital that's conducting research and have the benefit of that knowledge. from where you might be in a small town, or you might be in a different one of the different 4 countries in the UK. The guidelines are different. So I think there's the challenge of the NHS, and also particularly when it comes to drugs, and particularly within metastatic settings, how the NHS determines what drug access you get based on health economics. And so there are certain drugs you can access in the US that we can't access in the NHS, because based on the economics and what's seen as the severity of metastatic disease here in the UK, which has been downgraded, there's different access to drugs as well here for patients. So I think that's kind of a key thing. I think one of the things, and I know this was a commonality that we talk with advocates, is that scarcity of lobular knowledge across clinical practices and clinical organisations and even clinicians. And that desire to be at a centre that's got the specialist lobular knowledge. And at the moment within the UK, there's only, we've got 2 oncologists that are very actively involved in lobular research. And of course, all the patients want to be treated by them, which is practically impossible and physically impossible. And I've been talking with another oncologist, how can we tackle that? And actually, do we need to, we need to ensure that that knowledge is spread out throughout the health system, because otherwise it just exacerbates certain health inequalities that, that are already there. But then saying that, we also said, because of the guidelines, so the oncologists who are studying lobular and as part of their kind of special, their research, their hands are tied anyway, because the guidelines don't recognise lobular. So even though they may know more about lobular and they may know different, be aware, for example, on follow-up monitoring, their hands are still tied, even though they might know this modality is better for lobular, but actually I just can't give it you because it's not in the guidelines. So I think those are some of the real challenges that we're facing at the moment in the UK, which I think are quite similar to the US, a lot of them.
So can you say a little bit more about how, with your creation of the building of the network that you're doing, how you're working to address these challenges, and also say a little bit more about the policy changes and how you're going about focusing on?
Yeah. I mean, I'll use an example because I think examples always help. So one of the things we're really trying to do is work at the clinical level to increase knowledge and understanding of lobular. So, for example, we had an article recently in one of the national newspapers here. We actually worked with 4 individuals, 3 who were GPs, 2 of the GPs had had a lobular diagnosis, and the other GP, his wife, was a GP practice nurse, and she'd had a lobular diagnosis. All 4 of them had said they didn't know about lobular, they didn't diagnose, they didn't recognise that their symptoms were lobular, and they didn't self-diagnose. They were surprised when they were told they had lobular breast cancer. So what we've done now is we've set up a GP working group. They're working together, and we're looking at how they, from their clinical practice, but also their patient experience. So we're looking at how they, through that working group, can start changing education and knowledge amongst GP practices across the UK. So very kind of a very practical response, but working with the people that have that experience and that clinical practice.
How did you find them, Claire? How did they find you?
Yeah, one of them is Jane Sedcole, who's one of our incredible trustees. So she came through our trustee recruitment. One of them is Fiona Baba, who we bumped into at a UK breast cancer conference run by Breast Cancer Now. And she just went, oh my God, other people with lobular. She came to our stand at the conference. And then Debbie Parker, we work with an organisation called Future Dreams, and we run meetups down in London for lobular patients, just to come to get together and chat and get support. And Debbie came to one of those. And then obviously we met Vernon, her husband, who's the GP, through Debbie. And so we're now, one of the things we're looking at, they're talking about, is looking at how they can start developing some really simple research that can guide developing some GP specific information materials. So we can look at, is there a way that we can disseminate this then nationally? Other things we've done, this is one that you inspired me on actually, Laurie, so when you got your SEER data on lobular, and this is kind of working towards the policy change. And I remember saying to you, well, how did you get it? And you went, I just asked them. And they said nobody had asked. So Breast Cancer Now, who are brilliant in supporting us, whenever I don't know anything, I'm like, right, where might I find this data? And so they directed me to the National Disease Registration Service. I work with 2 incredible senior analysts, and they've just provided us with the first annual data for lobular breast cancer in NHS through NHS England. We're trying to get the data for the other 3 countries in the UK. And they've already said we get the next annual data in September, October time. So they're going to keep providing us with that. But we also consulted with the network and said to the network, are there things that you would like included in that data that we haven't thought to ask them? So we've started to get this lobular data, which is building the evidence that we can then use for the policy change. And so our big focus is really really driving our treatment guidelines campaign, which we've been planning for a while. We've had incredible support, again, from Breast Cancer Now and Cancer Research UK. Their policy teams have really helped us to plot out what we need to do, the stages we need to do to build the evidence, because the guidelines organisations in the UK, they're called NICE, which looks after England and Wales and kind of guides Northern Ireland, and then SIGN in Scotland. Lobular just isn't mentioned in the guidelines apart from once. We get a pre-surgical MRI to determine kind of, do you have a lumpectomy or do you have a mastectomy, and that is it. And I know, even though it's in the guidelines, some patients are saying they aren't even getting that. Other than that, lobular does not exist as a disease or a distinct disease or in any format. So one of the things we're doing is taking that data we've got, but we've been working on developing, it's a research protocol that seems to only be in the UK. It's called the James Lind Alliance Priority Setting Partnership. And they're set up by NIHR, which is one of the main funding bodies in the UK. And what you do is you bring together clinicians and patients to prioritize a research question. And so our research question is, what are the top 10 priority changes that we want in the treatment guidelines? Because we recognise we're not going to change everything straight away. And then what you have as part of that, of the priority setting partnership, is you have researchers who look what evidence is already out there to change those priorities. And so you can come to a point where you go, actually, priority 3, we've already got the evidence. So we can then approach NICE and say, look, we've got the evidence to change these guidelines, but the others might be, actually, we need more evidence. But because it's really recognised as this very systematic, very evidence-based process, you're a lot more likely to get funding to actually get the evidence you need. So that's kind of something that we are really focusing on, and we're literally about to start that process. And then we're also talking with the Department for Health and Social Care as well. We're talking to their policy and their research teams as well about key lobular changes that we need to put in place. So it's kind of very much the start of really driving these. And it's a new process for us at LBC UK. We, stepping into the policy arena, but we've been getting incredible support, and we just feel like we've got the potential to really build the evidence base for changing those guidelines.
What about the research? Is there a research arm like in the US? There's the National Cancer Institute and the NIH funding. Does NHS have a place that you can go to either participate as patient advocates reviewing grant applications or promoting them?
The NHS itself is the health service provider.
Yeah.
In terms of us engaging with research programs, We do that through building relationships with the key research institutions like the Institute for Cancer Research. The universities really drive the research process. And then our next step is looking at how we potentially can engage with research being done at a pharmaceutical level as well. And I think one of the things that we've been looking at as well is thinking creatively. Yes, we know absolutely we need more research, we need more research funding. And I know that obviously at Manchester Breast Centre, the Lobular Moonshot Project's done a great job at raising the profile of lobular. But I think we need more research funding, but we were looking at, is there a way that we can access more lobular data and get lobular data out of wider breast cancer research? If we do that histological breakdown, because what we've not seen is it happening. So we've been having conversations with institutions about, could we get some of the lobular data by encouraging, for example, there's a new UK breast cancer clinical trials group. So we're on the list to go and have one of the meetings with them to ask them, could you ensure that all the relevant clinical trials that could pull lobular data out of them get the histological lobular data? Because a trial might have been thrown out because it's shown for the majority of patients to not be effective, but in the lobular contingent, it could actually have been really effective, but it's been utterly dismissed in the results because they've not been broken down. And it could identify some really clear lobular routes for further research. So that's kind of one of the things that we are looking at. How can we really encourage the other ways of not just saying we need more money, but are there ways that we can actually get better data for lobular out of the wider breast cancer research that's taking place at the moment as well?
The organization that you mentioned, which like with SEER, there's reporting into across the UK countries the same way into one place for incidence of breast cancer, or is it more sort of disparate than that?
It's no. So the data that we get from National Disease Registration Service is it's the data they collect from what's documented when you're treated at NHS, but it's only NHS in England.
Okay.
Next step is to go, right, where do we find the data for Wales, Scotland, and Northern Ireland?
Yep.
And I think one of the things as well that's really important to acknowledge about the data is one, there's huge chunks of data missing. You can see that when you look, like certain categories say not known. But I think one of the key problems with data is the capturing, and this is not just for lobular, this is for all breast cancer, the capturing of metastatic data. Because we know the stage 4 data is most likely just de novo. And if you have a stage 4 diagnosis within your 5 years of follow-up from primary, because it's not capturing the late, longer term recurrence that we're seeing in lobular. So we know we don't have the accurate data for metastatic disease, but that's the same in the UK. And MetUp UK have been doing a really brilliant campaign to try and change that. Because if you don't know how many people have been diagnosed with metastatic disease, how do you then represent the voice and fight for the research and treatments? So that's a real challenge across all metastatic breast cancer here.
So what are your plans for Global Lobular Breast Cancer Awareness Day on October 15th?
So we thought we'd look at it in kind of 2 ways. So one of the things we're looking at is we're really keen on bringing patients and researchers together. And we're really keen on building a cohort of research advocates in the UK, so that institutions have got patients that can work with them on research. So we've done research partnership days. So we've done one with University of Edinburgh, we've done one with Manchester Breast Centre, where we bring researchers and clinicians together with patient advocates to talk about what research they're doing and get a real understanding from both sides of research patients would like to see, and patients understanding what their role could be as a research advocate. So we're going to be running one of those with the Institute of Cancer Research and also Royal Marsden and King's College and Guy's and St Thomas Hospital. So we're going to run one of those on the 15th of October, which we're really excited about.
Is that going to be something that you'll have virtual access to, or
not
just
sure at the
person?
minute. We're still planning at the minute. We've got another
Right.
planning meeting next week, but potentially that
Yeah.
could be something. But we've also got other members of the network that are saying they want to do some activity that might be linking up virtually with that research partnership day. We've got some new institutions. We've got some new institutions to the network who are also quite new to lobular research, or they've been doing lobular research quietly in the background and we've just discovered them. So they said they might do something where in their locality where they are. We're also looking at, and I don't want to say too much at the moment because we've not confirmed what it is, but we're toying with the idea. We thought it'd be really great to do a piece of citizen science on the day. That would be a simple piece of citizen science that we could, but we want to be able to get as many patients involved and feel like we're starting to drive change. So we're looking at what's a citizen science activity that we could get lobular patients to all join in with that actually gives us some results that we can take forward an action from it, so that we kind of bring patients and involve them in what's happening on the day as well. We did try to do the stock exchange, but unfortunately they only deal with financial charities. So
Yeah.
we wanted to do a bell like yourselves, but they were like, we're really sorry, but our focus is charities that are linked with finance. So they said no.
Well, our live stream platform on October 15th will open probably around, I don't know, 6 or 7 a.m. US Eastern time. So we might check in with you. We'll talk about this after. We can schedule it to see where you are and what's going on, and so we can publicize on the day, but also let us know if there's anybody who comes to our website to see what's going on in the UK, if there are things they can sign up for. We'll post that there too. And but it all sounds fantastic, and I love your citizen science activity idea too. So yay.
Yeah.
So is there anything we haven't talked about you'd like to share?
I think the one thing that I always think is really, really important for particularly for patients that might watch this is just that, and I think just the fact that you've invited me to do this, Laurie, is an example of it, is just that real sense of collaboration and connection that's across lobular breast cancer. I think so often patients are diagnosed and they hear nobody's doing anything, nobody knows anything about it, nothing's happening. And I think the one thing I want to say to people, the network we've got across the UK is incredible, but they're also a key part of international networks like European Lobular Breast Cancer Consortium, the International ILC Symposium. And there's this, and I think we've both been in the advocacy world now for kind of 5 or 6 years. And I think you'll agree there's a real change in the number of people doing lobular research and kind of really trying to drive that knowledge. And just that patients know there's this incredible committed group of really dynamic clinicians and researchers and patient advocates, and such as yourselves, such as kind of all the advocates that work across lobular, that are driving that change. And yes, we need lots more research. Yes, we need lots more money. But there is a real kind of, I think there is a change, I can feel there's a much greater energy and change that we're all working together for.
Yep, I completely agree. We are a global community, and I
Yeah.
think we are special. I mean, lobular breast cancer, 10 to 15% of all diagnoses of breast cancer. But I think we've been working hard together for past 8 years now, I think, to
Yeah.
grow this community and push for change. And I feel like it's working.
Yeah, definitely.
At the end of this, people stay tuned. We're going to put up Claire's Lobular UK link. We're also going to put up a link to get involved with October 15th activities on the LBCA website and join our community. Thanks, Claire. It's been great talking with you.
Thank you so much, Laurie. Really appreciate it.